If you're over 50 and your heartburn keeps coming back, this video might change everything you thought you knew about acid reflux. I had a patient come to me recently. This person did everything right. Everything. She didn't drink alcohol in the first place. She quit coffee. Eating small portions, no late-night eating. She exercised 5 days a week. And she learned taking digestive enzymes, probiotics, and vitamin C can be helpful and followed the recommended regimens. She ate early dinner and stayed up to make sure the acid wouldn't come up. But she kept getting worse. She went to multiple doctors. Her PPIs seemed to be working in the beginning. First, it took 3 days to feel better, then a week, then 2 weeks. Then the medication just stopped helping at all. The endoscopy this year showed atrophic gastritis. That's when she came to me with this dark, worried expression on her face. Here's what nobody told her. Heartburn after 50 may not be about too much acid. It's about something completely different. And if you don't understand this difference, you'll keep chasing symptoms while the real problem gets worse. Let me explain. Here's what happens to most people, especially if you start getting heartburn in your 50s or 60s. Maybe you always had good digestion before. Then suddenly food sits in your stomach. Acid comes up. You get that burning sensation. So you go to the doctor. They prescribe PPIs, proton pump inhibitors. These drugs block stomach acid production. And they work great at first. 3 days and you feel amazing. Problem solved, right? Wrong. A few weeks later, maybe a month or two, the symptoms come back. Same burning, same discomfort. So you go back, get another prescription, take it again. It works the second time too. Maybe the symptoms drag on a bit longer, but it still works. You repeat this cycle. 3 months, 6 months, a year, and something starts to change. The medication that used to work in 3 days now takes a week, then 2 weeks, then it barely works at all. So doctors give you lifestyle advice. Don't drink alcohol, don't smoke, cut out coffee and carbonated drinks, don't overeat, chew your food thoroughly, no late-night snacks, don't lie down after eating, don't do exercises that increase abdominal pressure like sit-ups or crunches, don't wear tight belts. If you're overweight, lose weight. My patient was doing all of this, all of it, and still getting worse. Why? Because the real problem isn't acid. The real problem is something called blood deficiency. Now, this is going to sound strange if you've never heard of East Asian medicine concepts, but stay with me because this explains everything. Blood deficiency doesn't mean you're anemic. It's not something that shows up on a blood test. You can't measure it by draining all your blood and checking the volume. It's not about the numbers. Blood deficiency means your body doesn't have enough blood to maintain healthy function. It's a functional diagnosis based on symptoms. And East Asian medicine has been observing and recording these symptoms for thousands of years. Here's what blood deficiency looks like. Heart palpitations, anxiety and worry that won't go away. Insomnia, especially from your heart racing at night. Panic attacks. And here's the big one. Digestive problems that don't respond to normal treatment. My patient had all of these. She'd been on anti-anxiety medication for over 10 years. She had panic attacks. Her heart would pound at night and she couldn't sleep. And about a year ago, she developed high blood pressure and started blood pressure medication. Do you think all of these things are just separate, unrelated problems? They're not. They're all connected by one root cause. Blood deficiency. Let me explain how this works. When you don't have enough blood volume to properly nourish your body, your heart has to work harder. Think about it. The same workload, but less blood to do it with. Your heart has to pump faster and harder to get nutrients to every cell. That's why you get heart palpitations. That's why you feel anxiety. Your sympathetic nervous system goes into overdrive. Your body is literally in a state of chronic stress trying to compensate for insufficient blood. And what does your body do to compensate? It raises your blood pressure. Because if it can increase the pressure, it can push that limited blood supply to reach every cell. This patient was thin, lean, never overweight in her life. no history of high cholesterol or diabetes, but she developed high blood pressure anyway. Why? Because her body was trying to solve the blood deficiency problem. Now, here's where it gets worse. The medications she was given for these symptoms actually make the reflux worse. Blood pressure medications can relax the lower esophageal sphincter. That's the powerful valve that's supposed to keep acid in your stomach. Anti-anxiety medications do the same thing. NSAID's painkillers for her knee and back pain? Same thing. All of these medications lower the pressure of that sphincter muscle. So she's treating the symptoms of blood deficiency with medications that make the reflux worse. And then treating the reflux with PPIs that make the digestion worse. It's a vicious cycle, but it gets even more interesting. Do you know which organ gets the most blood flow in your body? Most people guess the brain. The brain does need a lot of blood, but number one is actually the kidneys. They get about 20 to 25% of your total blood flow. But here's what most people don't know. When you eat a meal, that ranking completely changes. During digestion, your digestive system demands 30 to 40% of your total blood flow. Think about that. Almost half your blood rushes to your stomach, intestines, and liver to handle the massive job of digestion. Your stomach needs blood to produce digestive enzymes. Your small intestine needs blood to absorb nutrients. Your liver needs blood to process everything that gets absorbed. This is why you feel sleepy after a big meal. All that blood is being diverted to your gut. Now imagine you have blood deficiency. There's simply not enough blood to properly support this digestive process. Your stomach can't make enough acid and enzymes. Your intestines can't absorb efficiently. Everything slows down. And here's the cruel irony. When you're stressed or anxious, your sympathetic nervous system activates. Blood flow shifts away from your digestive organs and toward your muscles and brain. Because your body thinks you need to fight or run away. So if you have chronic anxiety from blood deficiency, your digestive system is being starved of blood flow even more. This patient told me something interesting. Her husband, who's in his 70s, got an endoscopy as they were getting an annual checkup together. The husband's stomach actually looked worse on the endoscopy, but the husband eats anything, has no reflux, no problems at all. He even eats late-night snacks and sleeps fine. Why? Because he doesn't have blood deficiency. His digestive system gets adequate blood flow. His sphincter muscle works properly. Age matters, but blood deficiency matters more. Let me tell you the other symptoms my patient had that nobody connected together. Dry throat. A constant feeling of phlegm stuck in the throat. Chronic cough. She went to an ENT doctor who looked at her throat and said it was clean. Chest tightness, which the GI doctor attributed entirely to reflux. But was it really? Or was it the heart palpitations and anxiety from blood deficiency? And her nails. Ridged, brittle, breaking easily. That's a classic sign. When stomach acid production drops, either from PPIs or from poor digestive function, you can't absorb certain nutrients properly. Iron, zinc, vitamin B12. These need strong stomach acid to be absorbed. Without it, you develop deficiencies. The nails show it immediately. She was taking digestive enzymes with every meal. And yes, that helps a little. But it's minimal, temporary help. Because you're not addressing the root cause. On days when she had severe indigestion, the enzymes did nothing. She'd be in pain all night, unable to sleep. Every year she got an endoscopy. Every year it came back normal, no erosions. But this year, the diagnosis changed. Atrophic gastritis. When I saw that, I immediately understood two things. The problem was old. This wasn't simple heartburn. Atrophic gastritis means the normal cells of your stomach wall are disappearing. They stop functioning and gradually die off. Without these cells, your stomach can't produce digestive juices properly. Indigestion becomes inevitable. Modern medicine has no cure for this. You can't turn those cells back into healthy stomach lining. The main concern is monitoring it because it can progress to stomach cancer. That's why they recommend regular endoscopies. But here's what this diagnosis told me. This person had been in a state of blood deficiency for so long that it had caused damage to her stomach lining. The chronic lack of adequate blood flow to the digestive system had literally caused her stomach cells to atrophy and die. This is not simple acid reflux anymore. This is not something you fix with PPIs and lifestyle changes. This is chronic disease that requires a completely different approach. Young people can get reflux from overeating, lying down too soon after meals, or doing exercises that increase abdominal pressure. That's mechanical reflux. It's temporary. PPIs work great for that. But when you're older and you've developed this pattern of blood deficiency leading to chronic digestive decline, leading to atrophic gastritis, you need to treat the root cause. So what do? In East Asian medicine, we use herbal formulas that do three things. 1. Tonify blood deficiency. 2. Calm the heart to reduce palpitations, anxiety, and insomnia. And 3. Strengthen digestive function. But herbal medicine alone isn't enough. You still need the lifestyle corrections. And fortunately, this patient was already doing them all. The exercise was especially important. Aerobic exercise is the most important thing you can do to strengthen heart function. She was already doing it 5 days a week. Perfect. The one thing I added was meditation and diaphragmatic breathing. There are clinical trials led by Duke University showing that diaphragmatic breathing significantly helps reflux disease. You can find tutorials easily on YouTube. If meditation feels too difficult or unfamiliar, just do the breathing exercises. They make a real difference. This patient has been taking herbal medicine for several months now. Her digestive symptoms are improving. Her anxiety and insomnia are getting better. I recommended she continue for at least 6 months. There's a saying in East Asian medicine, old diseases take a long time to treat. When symptoms have been building for years, recovery also takes time. The body heals gradually, just as it declined gradually. This isn't like treating a cold where herbal medicine works in a few days. Blood deficiency took years to develop. It will take months to properly address. But here's the important part. There's actually hope now. Before, she was just managing symptoms. Each medication addressed one problem. No improvement in sight. Just maintenance at best. Slow decline at worst. Now we're treating the root cause, the blood deficiency. And as that improves, everything downstream improves. The heart calms down. Anxiety and insomnia ease. Digestion gets stronger. If you're over 50 and you have heartburn that won't stay away, especially if you also have anxiety, heart palpitations, insomnia, or that throat discomfort, you might have blood deficiency as the underlying cause. People who say they have no stress but are naturally anxious personalities often have this. People who are naturally thin and weak with small appetites often have this pattern too. The underlying issue is blood deficiency. If you want more detailed consultation, you can find my website in the pinned comment. But the most important things you can do right now are diet and exercise. Remember, if you're stuck in heartburn that doesn't feel like just heartburn and have chronic indigestion, your heartburn is probably not about too much acid. It's about insufficient blood. And once you understand that, everything changes. Thanks for watching.